So if you guys are asking how I make my endo axis through crowns, this is how. So I already went through this is the PFM crown. So I already went through the PFM crown, and now I'm just gonna use my diamond burr and get to the pulp chamber. I love going through crowns because I get 4 solid steel walls to contain my irrigants. When I feel like I'm getting close to the pulp chamber, I usually stop and switch to my microscope and ultrasonic. I brush. I don't just go drill through. I brush with my diamond, and then when I feel like I'm getting close, then I switch to microscope and ultrasonic. There it goes. Let's switch. And I'm constantly refining and improving my endo axis as I'm working. The refining and the improving of the endo axis is I do it throughout the procedure. It's not like a one-time deal. I'm constantly refining it, improving it for better access, better visualization. So endo axis evolves. It's not a static thing. It evolves all the time. Alright, let me have the ultrasonic please now. Wipe this for me, please. Alright, my Ultramin Pro ultrasonic unit. You need the blue handle for it. The UM-2L. This is by 80th, of course. The ultrasonic unit is made by 80th. Yeah. Alright, let me have the. Thank you. You must have an ultrasonic unit if you do endo. Without an ultrasonic unit, you're just working blindly. So I got very close to the pulp chamber, so I switched to the ultrasonic because now I can use my mirror and see exactly what I'm doing. And I just hit the pulp and I just unroofed, and the roof of the pulp is gonna pop right out. And there it is. There you go. Excellent. Now I'm just refining the walls of the pulp chamber with my ultrasonic. I'm making them nice and smooth. When you make the walls of your pulp chamber nice and smooth, you can see better. Alright, and I'm gonna trough for the middle mesial right now. I'm troughing for the middle mesial while I'm here, just to make sure that if it's there, I'll find it. Yeah, I don't see it, so it's not there, but I'm still gonna look just to make sure throughout the procedure. All right, now I'm gonna use my flare file now, number 20 flare file, my M4 reciprocating handpiece, And I'm gonna open this tooth up, the coronal part, brush it, brush the walls, and pull out all the pulp tissue, as you can see. And you can see my working length is about, estimated working length is about 21, and I'm already going in about 19 millimeters into the canal. So I'm pretty much all the way to the apical part of this tooth already with my flare file. That's the mesiolingual. I'm not forcing it. I'm just allowing the file to go as far as it wants to go, and I brush away from danger zone, just like that. Now let's go to the distal, and I'm just gonna brush out all the pulp tissue. That's part of the pulp tissue that just came out. There you go. Just brush it out. Get all that stuff out. The more pulp tissue you can take out, the less likelihood that you block yourself. Because you can't block yourself with vital pulp tissue. See, I'm already going in about 19 millimeters into the distal buccal, and that's the distal lingual. So this tooth has 4 canals. I'm already done, and it's been like 10 minutes. All right, very good. Now I'm gonna use full strength hypo and just irrigate out all the bits and pieces of pulp tissue that we took out. Thank you. Excellent. Now I go in with my 8C file. And let's see how far it goes. Look, my 8C file is going really easily to my estimated working length already. That's the mesiobuccal. That's the mesiolingual. Look, I'm not even forcing it. It already goes all the way. Look at that. Distal buccal already pretty much done, and it's been 15 minutes 15 minutes into the procedure, and we're almost done. All right, irrigate after each instrument thoroughly. With full strength hypo. Okay. Thank you. Number 15. Oh, I didn't do 10. That's okay. Number 15 goes all the way to my working length. Look at that. I just need the 10, please. That's okay. Alright, so 15 goes to my estimated working length. This is the lingual estimated working length. Alright, thank you. Okay. All right.
Yeah, I don't know what that's about. do the 10. Are you going to want 15 again?
Yeah, 15,
okay.
please. This is a 10C file, and I'm working on the mesiolingual to my estimated working length. My estimated working length is 21, so I usually work a millimeter short, short of my estimated working length, just in case. If I'm off, I won't over instrument, or I won't instrument over, not over instrument, instrument over. C file.
Yes.
Just brush with it, up and down, brush, brush, brush. With these files and reciprocating handpiece running at 1000 RPM, you're also sonically activating the hypo. Thank you. All right, next is the SX orifice opener by 8 teeth. Be really careful with these. I've broken quite a few of them, so don't force them. Wipe them clean after each use. Brush, don't force it. See, the flutes are full, so you gotta clean, wipe and clean, and go to the next. Cuts so good. These are so sharp, it cuts so good, but be really careful with it because you can break the tip. All right, so let's measure. We'll go in there, and then we're gonna air it, so don't turn it off. There we go. We're gonna air the pulp chamber. Just air it. You don't want hypo interfering with your apex locator. All right. Especially definitely 4 canals, as you can see, 2 mesials and 2 distals, and you can see that I've troughed for middle mesial. I removed that dentin bridge just to make sure no middle mesial canal, and there is none. All right, let's measure. Alright, so I need to work on these. Let me have a 1021, please. Hypo. Alright. It looks like we're good. We're at 21. I'm gonna confirm one more time. But I'm gonna now use my 10C file to go to my working length now that I know it's 21. Thank you. Alright. now my 10C file, 21 millimeters. As you can see, I'm going to 21. Mesiobuccal, mesiolingual. Activating the hypo at the same time. And the distal canals. Alright, so I'm back to flare now and brushing with it and letting it go as far as it wants to go. It's going about 19, 20 millimeters. Just brushing with it. Mesiolingual, just brush with it away from the furcation. Distal, again, brush with it away from the furcation. Distal lingual, brush with it away from the furcation. Alright, very good. Yeah. Brushing and activating the hypo at the same time, instrumenting, shaping, activating all at the same time with these reciprocating hand pieces. Yeah. Capitulate with a 15C file. Alright, 15C file, please. Irrigate after each file, and 15C file goes to working length, up and down, recapitulate, so we make sure that we're not blocked. You need to do that after each file, just to make sure you're not blocking yourself. The white, so it's a 8 teeth white. The E Flex S, I just let it glide as far as it wants to go. I won't push it. I've already created a glide path for it. Wipe it clean. Distal buccal. Distal lingual. Check the flutes. See, they're full in the apical area, and that's what you want to see. We use microsuction to dry. Now we're going to use a little bit of our air to dry more. And now paper points, please. Final inspection. Everything looks great. No middle mesial. Very nice. All right. Up. Sterile paper points to dry the canals more further. All right. I touched the rubber dam, so I'm not going to put that in again. So I got to use the microscope. Come on, get in there. All right, very good. There you go. All right, paper planes. These are the distals, and it looks like the distals join. You see one is shorter than the other. All right. Sterile paper points, dip in my H plus sealer to coat the walls of the canal. Coating the walls.
Okay,
Back in.
I should do it.
Mesiolingual. Coating the walls. Distal buccal. Distal lingual. Just need to add a little bit more to the mesiolingual. There you go. All right, I use the injection technique. Don't recommend it for the inexperienced. I don't teach this technique, and I don't recommend it. So I'm not gonna tell you how I do it because I don't teach it. All right, thank you. Mesiolingual. Hence. And then here. We clean the pulp chamber with isopropyl alcohol and make sure it's clean. Let me show you how clean the pulp chamber is. Look at that pulp chamber. You can eat off of it. All right.
Playing on it.
Sterile sponge and cavet, and that's it. We're done. Sterile sponge, a big one. Give me another one, please. One more. One more sterile sponge. So let's put 2 in there. That's one. One more. Perfect, thank you. Sterile sponge goes in, and then cavet goes over the top. Cavet goes over the top. A little bit more. Perfect. That's it. Finito. Thank you. This patient was referred to me for endodontic treatment of tooth number 19, PFM crown, irreversible pulpitis. Look at all these pulp stones in the pulp chamber. And here is the post-op. So went through the PFM crown. As you can see, 4 canal systems. The mesials are separate and the distals join. Everything went beautifully. As you can see, we temporized the tooth and referred the patient back to her dentist for the permanent restoration. This patient had dental phobia, so we had to IV sedate her. So we IV sedated her and did this root canal. Everything worked out beautifully.